If you've been diagnosed with a meniscal problem in your knee, it is possible to restore the knee function without the need for surgery. Many of the techniques you can do yourself, and I'm going to show you those special techniques in this video. Before we begin, for those of you that are new to the channel, hello, my name is Daniel Lawrence. You're watching the Physio channel. Our mission here is to put as much helpful physical therapy content on YouTube as we can. So make sure you're subscribed and let others know about the channel. To help us get started, let me share a couple of facts with you about meniscal injuries. Damage to the meniscus, or what may just be usual age-related changes, becomes increasingly common after the age of 40. These changes often occur without pain or locking. So if you've had an MRI scan confirming a meniscus tear, the meniscus tear may not be the cause of your knee pain, and this may have been present before your knee problems started. So based on research, which I'll write about and link in the description, your knee pain may not be caused by the meniscus. Even if your knee problems are caused by the meniscus and your knee is locking, you can still restore the function without the need for surgery. In fact, research indicates that arthroscopic surgery for meniscal tears offers little to no benefit for pain or function. Again, I'll link this research in the description. Please remember, this is an educational video. We really hope it helps, but it doesn't apply to everybody. If you're in doubt about your knee pain, make sure you see a healthcare professional for assessment. This is home exercise number 1. Take a rolled up towel and pull it right up into the back of your knee. Then bend your knee as far as you can, transferring your hands around the front of the knee so that you can continue to bend the knee as far as possible. Repeat that 3 to 5 times. If the towel slips out of place, pull it back up under the knee again, pull the knee back, transfer the hands to the front and flex the knee as far as you can. The towel in there slightly changes the mechanics of the joint, creating a bit of slide and glide and hopefully making the joint bend a little bit further and making your stiff knee feel a little bit looser. After 3 to 5 repetitions, see if you can bend and straighten your knee a little bit easier than you could before. Let's move on to exercise number 2. For home exercise number 2, bend your knee as far as you can until it becomes stiff or painful. At that point, twist your lower leg out, so you're twisting your shin outwards, and you can easily do that by making sure your foot twists out as well. Help that movement by putting your hands around the leg just below the knee, just around the upper shin, and twisting the knee like so. From there, bend the knee back a little bit further and keep that twist whilst you continue to try and flex the knee. Move in and out of that flexion movement with the lower leg still twisted, and repeat that 3 to 5 times. Twist and bend. Okay? Twist and bend. The twisting, again, changes the mechanics of the joint and may help the knee to flex a little bit further. After your 3 to 5 repetitions, see if the knee feels a little bit looser and if you've got a little bit more flexion. You can also try twisting the other way. So turn the foot in, place your hands around the top of the shin and help that rotation by twisting in, and then seeing if you can flex the knee back whilst maintaining that twist. Again, 3 to 5 repetitions. And if you find the inward twist or the outward twist is preferable, then focus more on that rotation with that flexion. If it's both, then do both. After your 3 to 5 repetitions, possibly with the internal and external rotation, see how the knee feels and whether it's feeling a little bit looser, and you can straighten or bend it a little bit easier. This rotation technique may also help if you're having trouble straightening your knee. So rotate outwards, try and maintain that rotation whilst you move the leg out into extension. And rotate inwards and move out into extension. You can also combine exercise 1 and 2 by putting the towel up behind the knee again, then adding in the rotation and then adding in the flexion. If you're struggling with extension, there's a press and release technique you can do. Let me show you. I'm going to show you on my other leg because it'll be easier for you to see on the camera. Come down the back of the leg and you'll feel the tendons of your hamstring muscles. There's two tendons on the inside that come down to the back of the knee. They're easy to feel, so track those down with your finger down behind the knee. You'll then arrive at the top of the calf muscle as well. And it's that point at the back and behind the knee where some sore points can be found, and pressing on those can sometimes alleviate the pain and allow you to straighten your knee a little bit further. So the first thing is to have a feel around and find any of those sore points by exploring and pressing in firmly with your finger or with your thumb, or perhaps both. And if you find one of those, lock in position and apply some pressure for about 10 seconds, waiting for the pain and sensitivity to reduce. From there, then extend your leg by sliding it out forwards and straightening it as far as possible. Furthermore, try adding a glide to that movement. So when you find that sore point, push it down towards your foot as you extend the knee. That may help. Or do the opposite, press and then pull up towards you, up towards your thigh, and then extend, and that may help. Usually it's the press and down which helps, but sometimes people find the press and up feels more relieving. You may find it helpful to use a firm ball, a massage ball. A tennis ball may work, but might be a bit soft, so something a bit harder like a lacrosse or cricket ball would work. Place that in that sore area that you've identified, and then as your leg goes into a straighter position, the ball will press against the floor, press into that sore spot in the leg, and you can then contract your quadricep muscles, these big ones on your thigh here, and then start to work on that extension. So that may make things a little bit easier for you and be a little bit more practical. If that doesn't work and it's not precise enough, then don't worry about the ball. Go back to using your fingers, finding that particular sore spot, and then adding in that glide either down or up whilst you extend the knee. So I hope that helps. Give us a thumbs up or leave us a comment to let us know how you're getting on. Now let's move on to the next technique. So now you've had some practice at mobilizing your own knee, you can try the joint glides. Have the knee at about 90 degrees and place your thumbs right up behind the knee. The aim of this technique is to glide the tibia shin bone under the femur thigh bone. So place the thumbs behind the knee, wrap the fingers around the upper shin below that knee joint line, and then you're trying to glide forward and back. And this will be more easily achieved if you can make sure you relax those hamstring muscles. So you're pushing that shin bone forward and back underneath the thigh. Try bending the knee a little bit further and repeat those joint glides. Now it is easier if you can get somebody to do this for you, ideally a therapist, and this is a joint mobilization that I often do for my patients. But have a go at doing it yourself. In this next home exercise, I'm going to encourage you to put some load through your knee, simply using your own body weight. Start in the lunge position with the affected knee in front and use something for support if required. The progression is to bend the knee as far as you can and try and increase the amount of knee bend by bending a little bit further each time. I then recommend you add rotations. So keep your knee and thigh facing forwards, but turn your foot out. From that position, bend the knee as far as you can and come back up. Try turning your foot in whilst keeping your knee and thigh in alignment. Try to bend as far as you can. If one of these rotations is particularly uncomfortable, then quite simply focus on the one which is not uncomfortable and do the exercises like that. For the next progression, keep your foot straight and turn your knee out, bend and back. Or turn your knee in whilst keeping your foot in alignment, bend and back. And once again, the progression is to try and drop down as far as you can and get as much bend from the knee as possible. We're adding in these knee rotations to really make sure we restore a full range of motion and don't just rehabilitate the knee to bend in a perfectly straight line. So adding in the rotation of the foot and adding in more rotation from the knee and the hip will help to restore the knee more fully than simple up and down flexion exercises. So that's why we're adding in the rotations, to make your rehabilitation work better and make it more robust and more functional. So even if you do end up requiring surgery, these exercises will benefit you and give you a head start with your rehabilitation. And to be clear, you can perform 3 sets of 6 on each leg. That doesn't mean you need to do 3 sets of 6 for every different type of rotation, just 3 sets of 6, and choose your rotations each time, perhaps adding in some different ones for variety. So 3 sets of 6 repetitions on the affected and the non-affected leg is a great way to get started. If you find that easy or easier after time, then naturally you can add more repetitions, but also try to bend the knee a little bit further and explore those rotations so you fully restore the knee function. Let us know in the comments how you get on. My final parting advice is to keep walking, keep stretching, and keep as active as possible. And finally, if you're experiencing inner knee pain at night, a pillow between the knees can really help.